Imagine you're a 40-year-old man. You go to a doctor's office complaining of lower stomach pain. They do a blood test, urine test, ultrasound, and they don't find what's wrong with you. What would you do? Hello, everyone. This is Dr. Mitch Freeman, MD. I'm a board-certified family physician. I've been a physician for 34 years. I've been practicing in Yuma, Arizona for the last 25 years. I would like to share my personal experience with different medical conditions. And this is my own personal approach. You might not hear this anywhere or read it in a book, because this is my own personal approach, how I do things. So this patient came to me for a vasectomy consult. And part of my history and physical, I asked questions regarding any genital complaints, anything around the abdomen, lower back, and everything. So it came up that he had lower abdominal pain for the last 3 years. And he did seek medical attention with his primary care provider, who wasn't me. I'm seeing the patient for the first time. And he has lower abdominal pain for 3 years now. They didn't find what's wrong with him. Further questions, I found out that this stomach pain in the right lower abdomen, he was saying that it gets worse after intercourse, and that's a big red flag for prostatitis. So I told him, I think you have prostate infection, and let me examine you and confirm. So he agreed to that. So I did a digital rectal exam to confirm the diagnosis. Pretty much chronic prostatitis. You know, in the book and the medical training, they make it so difficult and so complex that it deters most providers from doing this diagnosis. But to diagnose chronic prostatitis is very, very simple. It's very simple. Digital rectal exam, feel the prostate and press on it. The prostate should not be tender, just like a woman's cervix should not be tender, just like a woman G-spot should not be tender. If any provider tell you a prostate tender on a normal exam on a normal man, they don't know. That's not correct. That's not true. You should not be tender. Press on the prostate just like pressing anywhere in your body. You should feel pressure, but not pain. So I examined that patient, digital rectal exam, gloves on your hand, KY gel, bend over, feel the prostate, press, very tender, press, very tender. The way I document is I asked 0 to 10, what's the tenderness? His was 8 out of 10. So we document this way in the future. And a month later, when I examine him again, I have some benchmark to compare where we were and where we at. So I told him you have a chronic prostatitis. I started him treatment. And by the way, I'm going to explain everything I do, no secrets, and for free. I started this patient on levofloxacin 500 milligram once a day, 30 days. I also started him on tadalafil, that's generic for Cialis, 5 milligram once a day for 30 days. And I also started him on finasteride, 5 milligram once a day for 30 days. And asked him to come back for a follow-up in 30 days. My experience, usually when they come back, their tenderness will be better. If it was 8 out of 10, it goes down 1 or 2 points in a month. So I expect his tenderness to be 7 or 6 out of 10. And we'll see which side is more tender than the other. What's interesting was his pain was complaining on the right stomach pain, but his prostate on the left side was more tender than the right side. But we document that. And we'll see how he does. Now, this is very common that I see men come and complain of atypical symptom of prostatitis. I chose to start my first medical YouTube video about prostatitis because it is difficult to diagnose, difficult to treat, and a lot of providers do a lot of mistakes on treating it. I'm not smarter than everyone else. I'm just like, I just look for it, examine, and treat. And I will tell you how I do it exactly. So this patient is not different. I've seen a lot of other patients that they've told their doctors their symptoms. They even went to specialists. I have patients that went to prostate specialists, the urologist, and they tell them nothing wrong with you, and they come to me, I examine them, tell them, no, you have prostate infection, I give them medicine, and they get better. Their symptoms will get better. And I will be making more and more and more videos, and I will be bringing patients. You will hear what the patients say, what's their complaint, and what's their experience. I really want to bring awareness about prostatitis. I feel like the prostate organ is a very much ignored organ in the human body. And from the medical care perspective, a lot of doctors don't examine, don't know how to treat. There's not good training about prostatitis, and they make it a mystery. They make it so difficult. I will be putting links down below in the description of different links for articles, websites, videos, talks about prostatitis. You'll see how complex the subject is. But really, my experience, I came to the conclusion to diagnose a chronic prostatitis is the prostate tender? Yes, that is chronic prostatitis. Treat it. Now, it's very easy to diagnose acute prostatitis. That's when a man comes complaining of typically frequent urination, burning urination, hesitancy, waking up at night to go pee a lot, maybe have some fever, maybe pain in the stomach or back or around the genital area. That's easy to diagnose. Now, the common mistake is they give them antibiotics for 5 or 7 or 10 days and they get better and that's it. What happened is they don't check them later to see if they have any chronicity, any chronic component. If you treat them and they're better and you bring them back and examine the prostate, if they're prostate tender, that has to be treated. That has to be treated as a chronic condition, because if you ignore it, it will come back, and it will come back in a different way. It could be lower abdominal pain, lower back pain, groin pain, headaches, body ache, not feeling good, erectile dysfunction, severe headaches at orgasm. I will bring you all these stories, my personal experience with prostatitis. So, few things make chronic prostatitis diagnosis and treatment difficult. So, I made a list of things that, in my experience, what makes it difficult. A lot of patients are not really forthcoming with their prostate symptoms, especially usually when you go to medical offices, the person that asks you questions is a female, and they don't want to tell this female, I have a problem with erection, I have pain around my anus or around my perineum, or I can't have an erection, or any sexual complaint, or they don't think it's related. So that makes it difficult. Another thing is, a lot of time, even though I tell the patient, look, you have a chronic prostatitis, this has to be treated long term. I'm going to give you treatment, you're going to get better, but you still need to come back for a follow-up. If you don't come for a follow-up, you're not going to get better. But they feel better temporarily, they don't come back, and then later on, they will develop symptoms. It could be the same way, or it could present itself in a different way, like stomach pain, lower back pain, leg pain, groin pain, other symptoms that they might not think is related. And then when they come back to me, it's like, remember, I treated you for prostatitis, told you to come back for a follow-up. You never came back. So that makes it difficult, especially if there's some financial burden on the patient they have to pay, and they don't feel like, oh, I don't want to go to the doctor. I don't want to pay this. I'm fine. It will get better. It will get better. And it's only going to get worse, because the longer you have the chronic prostatitis, the harder to treat and the more challenging, and the longer you have to treat it. Other things that makes it difficult is a lot of doctors, sadly, are not trained and not comfortable doing prostate exam. Men and women doctors, they don't want to do a prostate exam. So prostate get ignored unless they complain of direct symptoms related to the urinary symptoms, and typically they get medicine without getting examined. They will feel better temporarily and they ignore the problem, and it will just culminate and get worse. So I will be making more and more videos about prostate. I'll probably going to make at least 10 videos about prostatitis. I'll be bringing patients, talking about their experience, talking about how it was ignored and how they came up about to come to me and get treated. I'm not going to keep any secrets. I'm going to put all my information, all my knowledge, and the clinical pearls and nuggets that I learned through the years. I will put it out. I would like to raise awareness between patients, doctors, medical students, everywhere around the world. This is simple. Simple to diagnose, simple to treat. Why are we ignoring it? So, I will see you on the next video. The next video, I'm going to talk about the very first patient that made me examine every man's prostate whenever they complain of lower back pain. And it's interesting presentation and interesting story. I'll see you on the next video.